Well, good afternoon, and welcome to iHealth Radio and the iHealth channel. This is Eric and Nage, and this is Senior Health Series Talk Show. And today we're going to talk about a topic that probably we know about and we hear about, and but we don't know the details about. Specifically in this time, there's a lot of thing going on with insurance and government programs and legislation and changes. Um, but we hear in the news Medicare, Medicaid. But if you're a senior, if you're a caregiver, if you're someone that actually has interest in these types of program, I think you want to be on. At least you want to hear and see and watch this show. And we do have a specialist with us today, guest speaker, Michele Albohn, and she's with In Good Hands Medicaid Consulting, and she will be guiding us through their services as well as Medicaid programs changes in legislation, how it's going to play going forward, and who can benefit from these programs, who cannot, how to benefit from it, and do it the right way. And also, so some of the questions that we may have and may ask ourselves, we will hopefully get some answers today. And so without any further ado, I'm going to turn it to Michele and just to introduce herself and her practice, and then we'll guide the conversation from there. So we have about an hour here, or whatever time takes us to get the information to you. So please, if you're watching this live, great. If not, they will be on replay. Just take the time to listen to it and get the most from it, because it will be information that is valuable. So Michele, tell us about yourself.
Hi, Hurricane. Thanks for having me. I'm
Pleasure.
a certified Medicaid planner. My company is In Good Hands Medicaid Consulting. We've been in business since 2014 of May of 14. I do have a business partner that couldn't make it today, but I basically started in this field kind of by accident. I was actually just applying for a job. I got a job with the Department of Social Services. And at the time, my grandmother was suffering from the early stages of dementia.
Wow.
So she had dementia for at least 12, almost 14 years actually, before she passed away last January. But I started out working for Suffolk County Department of Social Services in New York on Long Island. And I got my feet wet that way. Um, I was approached by an attorney, and at the time, I was getting a paralegal certificate that she wanted me to come work for her because I was processing cases very quickly. I knew what I was doing. So I left the county and started to work for an attorney. Um, at the same time, I got my paralegal certificate. So I worked with this elder law firm in Suffolk County where I ran the Medicaid department there. I also did the usual elder law paralegal duties, such as doing trusts, wills, and estates. We did real estate, deeds, things like that. So I learned a lot there at the law firm. I learned the whole legal side of it. And I already had, on top of that, the inside knowledge of how a Medicaid case is processed when you're a Medicaid worker, which a lot of people don't have that specific expertise. After I was at the law firm for a while, I decided that I wanted to be a nursing home administrator. So I finished my degree in healthcare administration, and I wanted to see the inside of a nursing home. So I worked at a nursing home in Nassau County as director of admission and Medicaid. So I did both, and they kind of do work hand in hand. I was doing processing admissions for the nursing home, communicating with hospitals, reviewing patient review instruments, which is um, it's the tool that gets you into a nursing home if that's what you're looking for. It's like a medical paper tool, assessment tool. And then I was financially screening people for Medicaid and their insurance as well to make sure the facility got paid. So that was a very eye-opening experience working for a nursing home because you see how much of a business it is, unfortunately, and a lot of
It
it,
is. Yeah.
most of other than people actually needing to be in a nursing home, the other issue is that do you have payer sources? Um, you're never guaranteed your Medicare. You're never guaranteed a certain amount of days. We could talk about that later on also. Um, so with that
That's
experience, I decided that I didn't like working in a nursing home, nor did I want the responsibility of being a nursing home administrator. No offense to any nursing home administrators, but it's It is a very difficult job. Some of them are called in at 2 a.m. You're overseeing nurses, doctors, the whole staff, anything that goes wrong. So I started to pursue looking into starting my own business. And at that time, my grandmother was getting worse. So we had to place her in a nursing home as well. And I experienced a lot of what my clients come to me saying that they've seen, not taking the medication, over medicating, the spouse not handling it properly, was all going on in my own family. So we had to place my grandmother in a nursing home. Um, so
That's
I
tough
got,
information.
yeah, it's tough. It's tough for anyone. It's a tough choice, especially when my grandfather was alive at the time and he didn't want her to leave, but he also was contributing to her not being taken care of properly. Not because he didn't want to, he had different thoughts about how he should care for her. So he was thinking, oh, I'll give her an extra Aricept and it'll help her remember better. Um, she would take it because she thought she had, she hadn't taken it. So now she was, almost
Dublin, yeah.
dying at the time. So I started in good hands Medicaid after I got my certification as a Medicaid planner, where it's through the Wealth Institute. It's a similar certification to a certified financial planner, like your accountant, but it's specifically for Medicaid purposes. So I do Medicaid planning that's complex. I'm somewhere between your attorney, next level below an attorney, I would say, but way above a normal Medicaid consultant that you see out in the,
Social service.
average
Yeah.
nursing home or other consultants. Um, so I got into the business and doing it myself because I found that in each aspect of what I was doing, whether it was working for Medicaid or working for an attorney or working for a nursing home, I couldn't help people the way I wanted to. With Department of Social Services, everyone thinks, oh, this is social services. They're going to help me get my application done. You can't. You can't say you could do spousal refusal. You can't say that you need a pool trust. You can't say this is the document that I actually need, not the one that you gave me. You can't give any advice. So I was going through meeting with people at the time. There was face-to-face interviews when I was at Medicaid about 15 years ago, and you would sit with the person and work on the application with them, collect the documents and do an interview. You had to see originals at the time. So I would have people crying and I couldn't tell them that I can, just by telling you, bring me this piece of paper and that's what's going to get your case open. I couldn't do that. At the law firm, the attorneys have all the say in everything. But the clients didn't feel comfortable with the attorneys at times because they would not understand them, or they would talk too fast, or they were intimidated, or they were afraid they were going to have the clock run and they were going to have to pay the higher price. So I spoke to them. They also were overwhelmed because at an attorney's office, generally, you're given, like a list. Bring me these bank statements, bring me your income, bring me your tax returns. With nursing home Medicaid, you had to get multiple years. So I was helping the clients get those because they didn't know where to turn. And it was also making the cases take way longer. Um, and then the nursing home was a whole other issue because, you could only help certain people.
So, Michelle, my knowledge of Medicaid, I've worked with the Medicaid products in the insurance space, and community Medicaid, long-term Medicaid, and all this stuff. But most of the people think that Medicaid is for a certain bracket of income and resources. You're talking about, different level of Medicaid here, and is this something that for anyone? Because I mean, does anyone need to actually use services like this to actually get Medicaid? Or there is a specific way to do this for a specific type of population.
Yes, I work with just the elderly and disabled. So anyone who's just looking for insurance coverage, I would tell them to go through the health exchange for New York State, or that's basically one, that's also one type of Medicaid. The exchange is Medicaid, but people based on their income get a
High
subsidy.
level, yeah. Hmm.
I don't deal with people who, the pregnant population, the low income population, the SSI population. I deal with basically anyone who is Medicare eligible. So anyone who's been on disability and anyone who's over 65. Though for those populations, it's extremely important for you to have someone to help you with this because it is very, very hard to manage on your own. especially if you do have some assets. And especially in New York and especially on Long Island, there's a lot of people that do have an income that's over that Medicaid level, or they may have a savings account that has a little bit over the level. Um,
On a
some
property.
yeah, they own their property. Maybe they have a house in Florida. There's a few people that, may have a little extra assets than that. But you need to know what boxes to check off. You need to know what they're going to ask you for. You need to have someone to guide you through this because not only is it just the financial part of it, it's also the process after that because there's Medicaid's managed in New York State. So anyone who goes on Medicaid has to be part of a Medicaid plan.
Hmm.
And those plans, VNS, Aetna, Integra, those are the plans that we generally use, and they
I used to work for Venus.
yes. So that's who's taking care of your care. But you need to go through assessments, and there's a big process that goes with it. And if you don't have the right guidance, um, you can, it can also take a lot longer, and you can get denied wrongfully and not know why you got denied. We have people come to us all the time that say I got denied, and it's not that they were denied, they just didn't have a pool trust, let's say, because they had excess income. But when they called somebody, the doctor would say, well, you don't have any coverage, or the pharmacy would say you don't have any coverage. So there's a lot of little things people don't understand about Medicaid.
Do a lot of people know that this service exists, if they had assets? Because I think the majority of people think that once you have a house, you have resources, you have savings,
Yes.
you cannot qualify for this.
Yes, that's what most people think, and that's the biggest misconception about Medicaid is that if you have over the income threshold or you have over the resource threshold that you're not qualified for Medicaid, but that's untrue. So most of our seniors on Long Island have worked very hard, and in the whole state of New York, worked very hard. They have a little bit of savings. They may have a teacher's pension or a city pension, so they have some income. That doesn't disqualify you from getting Medicaid in either way, community or nursing home Medicaid. Um, it's a huge misconception, and a lot of the older generation thinks that it's just for the destitute, and it's not. And what we're trying to do is help people to apply for Medicaid before you're completely destitute, because there is a huge window, especially now, but we're not even going to go into the crisis. Um, there's a window of the filing date to the time when you're actually going to have your aid paid for. So if you've exhausted all of your funds and then decide to apply for Medicaid, you're going to be uncared for several months. And for some people, they've just waited too long. And that's usually what happens. People are waiting way too long to apply. They're waiting until their loved ones have multiple in and outs from hospitals. Some families are in denial. They don't think that it really is dementia or really is Alzheimer's, or they keep falling, but mentally they're okay. So I don't think they really need an aid, or the loved ones are stubborn. We hear that a lot too. Um, but we really need to keep our seniors safe. And especially now during this crisis, they need to be taken care of. They need to stay out of the hospitals. They need to stay out of the hospitals in general. And another issue,
Definitely, yes.
yeah, another issue is that we're living to be 100, 103, 105. So most people think, oh, I have, some money. I'm 85 years old. And next thing you know, they're 100 and now they've spent it all and they don't have anything. So we're living a lot longer. So we have to be able to financially prepare for that also.
Well, a lot of people are fearful, well, not fearful, they just, don't want to pursue this particular aspect of I guess insurance because there's a stigma with Medicaid. I mean, a lot of people think Medicaid equates and equals welfare, and no one wants to get,
Yes.
to especially if they lived a decent life, they had
Right.
their resources and assets, and now it's a reality check, right? So,
Sure is. It sure is a reality check. And I'm not saying that Medicaid should be your long-term care plan. It definitely shouldn't be your long-term care plan. I think our generation should learn what's happening now to properly plan for the future, whether you purchase long-term care or you do some other type of planning if you do have assets or you have properties, to make sure that when you do get to this stage, none of us believe we're ever going to get there. We're always going to be healthy and fine and never need any help and always drive until the very end and just go in our sleep, which we would all like. But um,
life, it doesn't work that way, does it? I mean, look at today. I mean, who would have known we'd be on lockdown? The whole nation, the
no,
whole the whole earth is on lockdown. It is
definitely
crazy.
not. But yeah, we have to be able to plan for the future. But our seniors right now, this generation that's from anywhere between 75 and 100, they didn't do the planning. They didn't have those things to plan. They didn't have, a lot of them couldn't afford long-term care at the time because it is very expensive. Some of them never thought they'd live this long. Some
And
of
we're
them,
talking about long-term care policies, insurance policies that you
yes,
buy as added value so you can have it when you get to the age of long-term care
correct.
need.
Right, right. Long-term care policies will generally pay X amount per day, whether you need assisted living, home care, and then nursing home. And even with long-term care policies, you can get Medicaid if your long-term care policy doesn't cover the full amount. So old long-term care policies, what we've seen, a lot of them are 150 a day, but right now a live-in is about 350 a day. So it's not covering your whole expense. So some people do need um,
Differential balance.
something to balance it out because care can be very expensive. I mean, if you're looking at $8,000 or $9,000 a month for a live-in aid, if you get to that point, that's a lot of money. That's a lot
And
of
most
money.
seniors may not have that money.
Most seniors today don't because they
Mhm.
came from a different era. They came from an era where they basically lived in the moment. They have their savings, usually very modest savings, and they want to protect it as much as possible.
So, in your service, people reach out to you when they really desperate, or is there a way for us to actually tell people, hey, listen, don't wait. If you have these qualifiers, maybe you should inquire today and see, to pre-plan, in the next few years what that plan should be for you and how it's going to help you. Because to your point, there's a time frame to apply. It takes time to get all this stuff approved. It's through the state and obviously through agencies. So it's not as easy as just fill out an application and you're done.
Correct. That's the application is the easiest part of the whole process. It's getting to the point, making sure that we've got all the assets in place, made sure there weren't any bank accounts not uncovered or life insurance that they didn't know about. But people should start planning sooner than later. I think Medicaid planning is important. I think Medicaid planning should be used not only to help cover services, but also if you get to the event where you do need Medicaid, you are protected. Um, it's very important to be able to get your loved ones the care that they need. And families also have to be on board because I find a lot of issues within families. You get multiple children who are not on the same page, and that becomes a problem because they each have their own idea of what they want to do with the assets, how they want to pay. Some of them think that they can care for their loved ones on their own, and that's difficult too. Spouses are taking care of other spouses, and the husband or wife is also sick, also not taking care of themselves. And we've had the well spouse, technical well spouse, pass away or be hospitalized, leaving the person we were applying for Medicaid for alone because they weren't taking care of themselves. So it's very important to have also a good support group to help you stay on the right track, and hopefully everyone is on the same page because it's very hard to have a family that is not on the same page where we're all like, okay, we're either going to go the Medicaid route, we're going to go the route of paying for the care, we're going to all try and chip in and take care of mom or dad. They have to be on the same page.
So, God forbid, let's take a scenario. Myself, my parents, we have a situation. They get an old, and they have some assets, they have resources. Just to break it down to people, how does this whole transaction work? From start to finish, from soup to nuts. Like, somebody sees the value and they get into a point they need to figure out how they're going to do this whole home care piece of it, and it's going to cost them. They don't have insurance, and now they need to pre-plan this whole thing and work through it. And now you have families that may not have caregivers or children. That's one group. And then you have the ones that may have a group that has mixed feelings about this whole process, because I think what the question is really is what would someone object to in this process if they were caregivers?
Applying for Medicaid, you mean? What would
Yeah.
they object? Some of them don't understand the process. Some are very wary of estate recovery on certain things. Um, most people's biggest asset is their home that they're living in, and right now the rule still stands that if you're living in your home and you're receiving community Medicaid, there's no lien put on your home. If you leave your home and you don't have a spouse or a disabled adult child, that's a different story. But generally, people are looking to stay in their own home. So if your home is where you live, it's where you're living. You don't own any other property. You're not going to have a lien put on your home. Some people are worried about income because I know you know a little bit about the pooled income trusts. Pooled income
Yeah.
trusts, yeah, they throw people off. They don't understand the process. It is difficult because you're taking your asset, your income, and you're taking a portion of it and putting it in a different account that you don't have control over. People don't like that. A lot of
Of
seniors,
course, you're giving your money away.
yeah, seniors are they like to write their own checks. They like to see the paper go out in the mail and put a stamp on it, and this takes that away. So a pooled income trust, for anyone who doesn't know, is a nonprofit organization that helps the elderly and disabled protect their overage for Medicaid. So an income overage is right now what is the level is $895 a month. That's
Per
the
person.
Medicaid threshold for one person.
Mhm.
For a couple, it's 1304. Basically in New York, for a good part of New York and especially Long Island, everyone's income is over that in just Social Security alone, usually. So Medicaid says you have your Social Security, you have a pension. We take all the gross amounts, not after taxes, gross amounts. You're allowed to pay for your health insurance premium. So that's Medicare, that's your AARP, that's whatever you pay for as a secondary. And then they allow you to keep the $895 imaginary. Okay. Anything over that goes into the pool trust.
So you
So
will
that,
not have access to that extra money. The only thing you have access to is that 895
right. So that 895 is basically yours. You can have
vacation with it.
cash. Yeah, you like having cash on you. You want to pay your landscape or whatever. That's fine. But the rest of it goes into the pool trust. Now, your family member is, or your designated representative is going to contact the pool trust and say, okay, this is what I want to pay. I have to pay my mom's rent. I have to pay her mortgage. I have to pay her cable bill. I have a credit card. All those things the pool trust will pay on your behalf. So you're not writing out your checks, someone else's. And that's one of the big reasons why people are confused about Medicaid and also don't like not having access to the income and they don't want to go forward with Medicaid. But that's only your income. That's not your bank account. It's not your savings account. It's not your IRA. It's just your income that you receive on a monthly basis that's over the 895 or 1304 for a couple.
Now, is there a fee for this, the actual trust pool or
Yes. The pool trusts or
pool trust? I'm sorry.
yeah, there's quite a few pool trusts in the state of New York. They all have basically the same fees. They do have a startup fee. Most of them are around 250 to 300 just to fund it. Then on a monthly basis, it's usually about 10% of what you're putting into the trust. So if you're putting in 1200, they're taking 120 a month. Um, and they cap it at usually um, at 200 or 250, depending on the trust that you use. There is a fee for it as well.
So that's a service fee to manage it basically.
Yeah, and
And
that's something that nobody can get around. Unfortunately, it's a standard in the pool trust that they all charge a fee.
if you choose to use a
If
pool
you
trust concept,
Right, right. Someone who has, let's say, a small overage of income of maybe $200, I wouldn't use a pool
yeah.
trust for that. But people need to know that if you have an overage and you don't use a pool trust, that overage amount, no matter how big or small it is, you turn it over to Medicaid as your premium. You have what they call provisional Medicaid when you have an overage. So until you satisfy your overage, which means you write a check to your local Department of Social Services, you don't have coverage. And some people don't realize that. But a pool trust, anyone who
Is that
needs
is that spend down?
spend down,
Okay.
that's spend down.
Yep.
It's overage, it's spend down. People call it a lot of different
Yeah,
things.
I just this way,
Yeah,
because some people would know it as spend down and not as much as overage.
yeah.
Um, so again, going back to that scenario, family, elderly in the house, they have children. They may not want to go to the pool trust route. What can they do, and how would they kind of work this whole process? Can you guide us through the whole start to finish,
Um,
step
the
by step?
Yeah, the Medicaid process, I do suggest hiring someone who is qualified, but if you can't,
You guys are available.
we're
Yeah.
available. Um, but it's a long, it takes on average for us about 6 months to complete one home care case. So we're doing 6 months of work. It does take usually up to a year for a nursing home case because of the 5-year audit that we have to do. So someone has to first get all their documents together and complete the Medicaid application, file in the proper county, and correspond with their local Department of Social Services as far as what documents they ask for. New York State does run the Social Security numbers of the applicant and a spouse if the spouse is alive. So if you think you're going to not give them something, they will find it. So that's an important thing for people to know. Some people think, oh, I have this life insurance policy, but they're not going to find it. Or I have this CD with my kids on it. That's not really mine, it's my kids. Oh, it's yours. And they'll find it and you'll get denied and you'll not realize it. But if you do get through the part and you do get your financial approval, you don't just have an aide automatically show up at your door. You have to go through assessments, you have to go through multiple assessments and get enrolled in a Medicaid plan. So that's why it takes so long. It's a very long and unfortunately drawn out process, and it's going to get longer and more drawn out in the future.
So there was some, well, there was, I've heard this, that, the state would even look at foreigner accounts. If you have some dollars or other income in a different country now, they can still find that. Is that really something that people should be, concerned about?
Absolutely, absolutely. When I worked at Medicaid, there were accounts found in other countries, but now that they're running Social Security numbers, they are able to find that. So if anyone does have property in other countries, you do have to be aware of that because it could be found and then you have a big problem.
Yeah, because in a lot of countries now, the banks will demand if you're a United States citizen to actually provide documentation and so on and so forth and taxes, and it's reported to the IRS. So you just can't hide anymore.
You
You
can't
got to
hide
do
it.
it right.
Yeah, and you shouldn't hide it. I mean, we all see what's going on now, and our economy isn't doing well. And people, who really need the help should get the help. And our seniors really, really do need the help. They do need to be taken care of. They do need to be kept healthy. Our seniors are the biggest population of Medicaid recipients that are the most expensive for New York State,
Mhm.
which a lot of people don't realize. They think it is the poor and the indigent. It's the nursing homes, it's the home care. That's
High
what's
cost.
that what we're paying for, not someone, to have their kids on Medicaid. It's mostly the seniors. But they do need it.
So, and we've had the conversation that there are some changes now into the Medicaid that we may not be aware of.
Yes.
Would you be kindly to guide us through some of the changes, just the highlights?
Yes. So in the past, one of the biggest misconceptions, which was going to be one of the questions we were going to talk about until this happened last Friday, was that community Medicaid has a look back, just like nursing home. So there's multiple levels of Medicaid. So you have straight Medicaid, not through the exchange, Medicaid for those who are, attesting to resources. So you don't have to prove that you have where your bank accounts are or anything. You just say, I have less than $10,000 and I apply for Medicaid. And that gives you doctor services or services for your children. Then there's community Medicaid, which is your home care, your daycare, and your Medicaid assisted living programs. And then there's nursing home. So nursing home Medicaid is the top Medicaid that you can get that covers nursing home care, which is very expensive, and that entails the 5-year look back. So the 5-year look back means that we have to go through all bank accounts that are open or closed, and Medicaid will determine any gifts that you've given. So if you've given money away to children, grandchildren, wedding, college, um, your accountant said give 14,000 per child and spouse per year. That's all gifted. So they'll look at your bank statements for 5 years. They'll total up anything from usually 1,000 that goes out to a family member, and they'll total it up. So let's say after 5 years, they total up 50,000 in gifting that you've given. You divide that number by a penalty rate, depending on which county you live in. And that's X amount of months they're not going to pay for your nursing home care because you've given away gifts. That was only for nursing home. Now, as of the budget that just passed on Friday from Governor Cuomo, who's doing a great job, um, there is a 2.5 year look back now for community Medicaid. So in the past, community Medicaid, if you say came to me and said, I need Medicaid for my mom, she has a little bit of money, but we're gonna, we need to get care as fast as we can. We would put together a Medicaid plan and say, okay, Hurricane, we're putting the application in May, and she'll have Medicaid from May forward. That's not the case anymore. Now they're going to do the same thing. We don't know at what rate they're going to be penalizing people. I think it's going to be about half of the rate that um, we have for nursing homes.
Hmm.
So they'll be penalizing people where if you apply and you have given gifts, you cannot get community Medicaid. So that means that families are going to have to use their assets to pay for some care so that the government isn't footing as much of the bill as they
No,
have.
sorry, good.
Well, that's okay.
So they look at the look back is really to ensure that no one is beggars playing games and just giving money in
Correct.
preparation for this process. But what about if someone really does not have any idea they're going to plan for this? They were literally given money for a gift, for a wedding or whatever, school for grandkids, and then this happens and they decide that this is the only way out. How is that going to factor in? I mean, is there a way to prove that that's actually legitimate and it was not done maliciously?
The only way to prove it is to document that you've used it for your care for some reason. A lot of kids, for some reason, I don't know why, but they'll go and buy their parents a couch or they'll go and get a stove and they'll put it on their credit card and then they'll take money from their parents and put it back in their account. That's extremely messy for Medicaid because unless you have some sort of proof that it's that stove or that couch went actually to your parents' house, Medicaid's going to say your parents bought you a couch or a TV or whatever. And those several $1,000s is really a gift.
And it adds
So
up.
it adds up. But that's why you hire someone like us, where we help you get the right care, and we help reduce any penalties that we are able to reduce. We also put things in place so we make sure that you have care while you're in your penalty um, for hopefully short period of time. Obviously, someone who's gifted hundreds of thousands is
Forget
going
it.
to have a problem anyway. But the people who've legitimately just done some maybe things they didn't know were wrong, did give a gift for a wedding. Those are usually smaller gifts, so it's not something that's going to affect a lot of people. So you might have half a month they won't pay for, so you cover the month on your own. But someone who's given, say, 14,000 to 5 kids every year is a problem.
So I guess the advice will be if someone is pre-planning their future right now and considering all different options on the table, if they do their math, they know that eventually they live long enough, there may be a problem. So maybe there's a time to consider that, no more gifts,
Yeah,
and the kids also have to understand that they will impact the ability and they'll wind up paying for the bills or stuck with them themselves because they're going to have to
right.
care for the parents.
Right, right. You have to plan for that. So as much as it's nice for your parents to give you a gift, you also have to know what consequences those will be. Look, if your parents give you a gift and they're 70 and healthy, great. Hopefully that 2.5 years, that 5 years passes and you never have to have any adverse effects from it. But if your mom and dad already have dementia, they're already in and out of hospitals, and you think, oh, I'm just going to take this money and then they'll get Medicaid and I could pay my bills or I could pay for the house that they're living in my house. It's not going to work anymore. So people have to be much more aware of what's going on and make sure that their parents are planning ahead of time. If you need to do plans, if you have excess amounts of money, you definitely want to plan at least that 2.5, 3 years before your parents are sick.
So what would a child, have as an objection? I mean, I almost asked the same question earlier, but I'm the kid, I guess, and then I'm gonna put it out there. Some people may think, well, my parents are getting old. there's some inheritance that's coming to me, you
I know
know.
I didn't want to say it, but yes.
Yeah, I mean, I'll ask the question. But people actually, it's human nature, right? It's like an asset that I'm waiting for it to actually be available to me. And so at that point, obviously there's a motive, for me and a reason for
Yes,
me not to accept,
right.
to do something like this, right? I mean, is that a case? I mean, do we have that problem? And
A lot,
if a lot,
a lot, a
so
lot.
people do refuse to actually help, in this. But wouldn't that be a problem? Because at the end of the day, when your parents are not able to pay, someone's gonna have to pay, and you are ultimately the one that's caring for them.
Yes. I think there are some people that don't get it, or they unfortunately are just waiting for them to pass.
Yeah.
Um, an inheritance to some people is more important. Whether the inheritance is 5,000, 10,000, or 500,000, to some people that's the most important thing, and it's very sad. But people are going to have to realize that. Look, there are a lot of kids that probably even more now, so with this going on, living with their parents again because they're out of work. Adult children, or divorced, or whatever the situation is. And their parents are contributing, paying for the household, or the household's paid for already. But you do have to realize that they are getting older. One day they aren't going to be here. And if they're sick, they're the priority. Any money that they've saved in their lifetime should be to care for them. And that is the most important thing.
That's the right way. That's the right thing to do, and hopefully, but I think for me, just the planning or pre-planning. If someone is watching this or listening to this program, again, advice: if you're old and you get in there and you feel that you should have some different planning, and I guess your will and whatever it takes to make sure that none of the stuff happens. Maybe there's something that can be done where you put some sort of a clause in there that I need this done, regardless of what my kids think. I don't know. It's just I'm not giving
I guess
advice, but
they,
I'm
yeah,
just yeah.
I guess they could. This us, as we get older, we should probably make sure we do the same things for ourselves. But I
It's
think,
scary, huh?
yeah, it is. And as things progress, and the way the economy is going, who knows? Next year there may be a different budget implemented, and there may be different things to make it harder to get Medicaid. But it is a very important program. There are a lot of benefits to it. Um, Community Medicaid gets you your aid in the home, who can do activities of daily living. So basically, if you need help showering and dressing and toileting and meal prep and light housekeeping, that's something that they'll provide for you, um, which is the biggest thing. Daycare is also another, adult daycare is another nice benefit. If you have someone who's social and they like to go out and play bingo and things like that, they also have that socialization. Plus, a lot of the medical model daycares, they're called, that Medicaid covers, also provides medication management, showers, meals, physical therapy, and usually therapists too, if there's dementia or other kind of cognitive deficit involved. So those are good, really good benefits to it. And I think because an aid is so expensive, you know, I would rather people go the Medicaid route and get their parents the help than to try and take care of their parents on their own and not apply for Medicaid because they don't know which way to go. But there is a surge right now of, I don't know if you're familiar with the Consumer Directed Personal Assistance Program, or CDPAP.
Yes.
CPAP is a program where a adult child, or any other family member can be a paid caregiver for their loved ones under the Medicaid program. So this is something that's happening now because we're all out of work, or we're working remotely and we have more time. So people are taking care of their parents or elderly loved ones. And right now, people, if they're already on Medicaid, can sign up for CDPAP and get a paycheck from Medicaid in order to care for their loved ones. This is a program that has been very beneficial. There are going to be some cuts to this going forward. In the fall, as of October 1st, is when all of the changes are being implemented for Medicaid. So
Wow.
there's probably going to be a huge surge of applications that are coming between now and the end of September. Everyone's going to try and get their applications in to get under the new rules, because anyone in prior to that get grandfathered in, so they're not affected by anything coming up in the future.
So would that mean that the program will be the qualifiers will change. So if you want to be part of it and participate, you'll have to go through a different measure and process, or is that, or it's just going to be eliminated, or
No,
just
it's not
because nobody's.
eliminated. It's
Okay.
not eliminated. They just want to reduce the amount of fraud. So they're looking in different ways to protect that, obviously.
Sure.
But home care in general, not only will there be the 2.5 year look back, but they're also going to do different qualifiers and a different assessment tool. So it could result in lesser hours than people have been getting.
So like similar to with the UAS for the nurses
Right.
qualifying.
Yes.
So if you're not really qualified under that particular grid, you're not
Right.
going to be able to get the X amount of hours that you demanded or you thought you were
Right.
qualified for.
Right. So now they're going to have a minimum, I think, of three qualifiers. You need assistance with three ADLs in order to be qualified to receive home care. Um, and then
And,
the MLTC will take that, assessment and make their own assessment on that to provide hours. So not only do families, you may be able to qualify for Medicaid. And let's say your parent really needs 10 hours a day, but they're only giving 6 or 8. There has to be that cover up. So if we can put together some plans to help people save some of their assets, or use some of their excess income to pay for these hours that aren't covered, that's helpful too, because we're going to see a gap, in the amount of hours given and the amount of hours really needed. And that has to come from somewhere.
so definitely, I mean, right now is a good time to start consulting and getting some of that stuff prepped, especially if the next couple of months it's going to change. So these people can get in and you guys formulate, the plan of action. And so you can have the assets and the resources to pay for that all, difference in gap in care.
We
So,
meet
yeah,
with
go ahead.
someone, sorry, and we go through their, not only their health history, but their finances as well. And we do a thorough look back. We were doing questions and during our consultation, we were talking 5 years because we found that even applying for community Medicaid, they were finding that someone sold a house in 2012, only applying for community Medicaid, and we'd have to prove that this house was sold. So it makes things difficult. So we were trying to be on top of it. Sometimes it just, you know they throw you a curveball anyway. But we want to make sure that we put the plan together for you, very comprehensively, knowing what you're going to go through in the future, what your care needs are going to be, and how much money you have available to you.
So a question just to avoid some confusion, because a lot of the seniors are qualified for Medicare.
Yes.
And, a lot of people may think, well, I got Medicare, I'm paying my Medigap, MedSups or, policies, I should be covered. But, I guess that is not the case, not when it comes to home care at an extensive amount of hours.
Yes.
So just to clarify for people, and Michelle, if you can just chime in there, you
Sure.
know, because people think, well, I got this, I got, if I get Medicaid, I'm good. But really, is that really the actual end game?
No, Medicare and Medicaid are usually, and I don't know why they named them so close together, but Medicare is for those who are disabled for 2 years or over 65. That's your main health insurance through the federal government. That is so far an entitlement.
Sure.
Hopefully it continues that way. We don't know.
Not sure. Yeah.
Your premium for your Medicare comes out of your Social Security check. Okay, and it's about 144.50 this year. It goes up every year. Just like your
Mhm.
Social Security goes up, your Medicare premium goes up as well. Medicare primarily covers your doctors, hospitals, and if you need skilled care. So if you break a hip, need hip replacement, or need to go in for rehabilitation in a nursing home, it covers. There's a total of a 100-day period they give you. The first 20 days of your rehab is paid in full while you're in a rehab facility, as long as you have a 3-day qualifying hospital stay. So you have to have the hospitalization, 3 days,
Discharge.
right? You get discharged to a nursing home for rehab. You get 20 days paid in full. Depending on if you have, an Advantage plan or a Medigap plan, days 21 through 100, there's a copayment in the range of about $178 a day.
Wow.
2020. Some people have a supplemental policy like AARP, which is the biggest ones, United Healthcare AARP. It's expensive. It's about 300 a month, but it will cover you for the next 80 days. So your Medicare and your supplemental will give you that full 100, which I think is beneficial for any senior who has like dementia or history of falls or other chronic illnesses, because that gives you a full 100 days. Once you get discharged from your rehab, Medicare is only going to cover a little bit of rehab at home, giving you 2 to 3 days a week of rehab, physical therapy, occupational therapy. You'll get a shower once or twice a week from the aide. That lasts 4 to 6 weeks, and then you're left on your own, because Medicare, like I said in the beginning, is skilled. So it covers your skilled needs, the needs like your physical therapy, or if you need, intravenous, or you need wound care and things like that. When you need custodial care, which is our seniors who just need help going to the bathroom, they need to take a shower, they need their meals prepared because they're using a walker and they can't
Andre.
get around. That's what Medicaid covers. A lot of people think, well, I have Medicare, or I'm a veteran.
Yep.
Veterans only get, I believe, and I'm not a specialist in veterans benefits, but they do get some hours, but it's somewhere in the range of 12 hours a week or 20 hours a week. And that may be good in the beginning, but once you need a lot of care, you can still have your veterans benefits, take care of that 12 hours, and then you get Medicaid to cover anything additional.
But again, I mean, the idea here is that while you have Medicare, Medicaid, and all, and maybe even veteran benefits, it is still limited and it's not long term, and that's where the Medicaid piece comes in, as a priority, and to especially someone that has these conditions and expect to have them for a long. I mean, once you have them, you have them. I mean, it's until the
Yeah.
end, right? So,
Especially dementia. Dementia, my grandmother had it for 14 years before she passed
wow.
away. She was walking, she went to the bathroom on her own, she dressed herself. She just couldn't manage her own, manage herself. She couldn't make meals, she couldn't do anything like that. But dementia, you can live a very long time with dementia, because most dementia patients, strangely enough, have very little physical illnesses. They just have dementia. So they
Mhm.
just need that constant supervision. And it's like having, someone watching your kids. You need someone to watch your parent who has dementia, because they can turn on the stove, they can walk out of the house and go to a neighbor's house thinking they're in their own house. And those are the prime things that Medicaid covers, is the custodial care, especially in the case of a dementia patient.
So, just in interest in time, Michelle, do services like social workers and things like that in different agencies around the city, do they actually use can they be deputized to actually assist some of these folks and help with this process through you guys, for example?
No, we're private. We're a private company, so we do charge fees for our services, and our fees are based on what we are putting together for our clients. We get very involved. We're hand holders. We're compassionate. Anyone who wants someone to be there to talk to, someone that wants you to hold their hand, that's us. Um, now with the now with the changes coming in the fall, it's going to be even more important to hire someone who is extremely certified and professional and knows what they're doing with Medicaid. Because with this look back coming in for community Medicaid, you can't just, there are a lot of people out there that just do Medicaid applications, maybe as a side business, or, helping people out. That's
Not their primary.
right. It's not their primary. And even if it is their primary, they don't have the knowledge to guide people through this process, to get them past it. If people come to us mostly in a crisis, so we have to take the crisis situation and turn it around and make it the best we possibly can. And that's what we're really good at, is dealing with people in the most vulnerable times of their lives and helping them get through it as much as possible. But you definitely need someone who is very qualified to do this, as opposed to someone that just says, I can do this for, $100, I'll throw in your application. That's not going to help you. It's going to actually make things worse for you.
Well, I appreciate it, and it's important to understand. I mean, yes, this is something that's going to cost, but it will save you in the long run, and ultimately will get you the right plan that's going to help you,
Exactly.
get everything that you need. Um, so, how can people, reach out to you and get you assistance?
So you can reach out to us. We have two offices. One office is in Hopog. That's our main office. The phone number in Hopog is 631-946-1918. We have an office in Glen Cove, um, right in downtown Glen Cove. That number is 516-220-8494. We have a website, ingoodhandsmedicaid.com. We have a blog, which is the it's medicaiddiaries.com. Um, you can email us. We have, just like everyone else, there's access on the web to send us an email through the site, or you can send us a call. Call us anytime. We're working remotely like everyone else, but calls are being forwarded to our homes, and we're helping people doing meetings like this. We're doing Skype, FaceTime, Zoom, however benefits the family or they're technically able to handle. Otherwise, we're doing also phone consults and helping people electronically get their documents prepared through email or fax. And then there's also snail mail, which we can use as well. But we're here, and we want to help people as much as possible before these um,
Changes.
changes come into effect. So we're hoping people that the word gets out that they should not wait any longer, because a lot of people have told us they've held our card for a year before they decided to call us because either they were too busy, didn't have time, didn't have that thought it wasn't going to work out, or their parents are too stubborn. Well, now's the time. We're all home. Let's get this process going, because as it stands now, it's going to take almost double the time to get this process completed, because everything is slowed down within Department of Social Services. They're working less, they're taking turns, they're alternating days depending on which county you're
Mhm.
applying to. They have different regulations that prevent them from working every day.
Now, Michelle, your services are ultimately for New York State, not necessarily just in Long Island, right? You can get cases from all over.
I can. My certification is national, but I specialize in New York State. So I cover the entire state of Long Island. We the entire state of New York. Um, a lot of our clients are from Long Island, but we have clients up in Rockland County as well, Westchester County, all five boroughs, Staten Island. Um, we reach out to everyone everywhere. Most of our business does come from referrals. We deal with a lot of hospitals, nursing homes, social workers that refer people to us, nursing homes. Former clients refer to us as well. But we're here and we're ready to help you. We want to make sure, especially now during this pandemic, that we're keeping our seniors out of the hospital, because they're the ones that are dying from this. I had two clients recently pass away
Sorry.
from
Sorry.
this. So we have to keep them home. So whether you want to be a caregiver for your parent and get paid through Medicaid, through CDPAP, we can help you get on that program. If your parents need an aide, all the agencies are out there doing extra special training so that their aides all have proper training in cleanliness and sanitizing and how to care for someone. They're all being tested before they go to work, so they're taking the same precautions just as if they worked in a facility, to go into someone's house. So you don't have to be afraid if you can't get to your loved one and they're alone and they do need help. It's better to get them help than to leave them and hope that they're okay during this time.
Well, I mean, a lot of people right now have this concern, and I actually had a conversation with a friend of mine, and the discussion was about home health aides and the fear factor of people going to somebody's home and or bringing, the bug in and all that stuff. So there's a concern, obviously. So
There is a concern, but there's also the consumer directed. While you can, do it now, it's something that can help people, but you have to start the process as soon as possible, because by the time you get approved, it could be all over. So people should start and contact us today.
all right, well, Michelle, thank you. I mean, I think there's a lot of valuable information that you share with us today, and a lot of it I've, literally it's news to me myself. And like I said, I know some of the stuff through, my practice and work in the insurance world, but it is more details and things like that that we needed. And again, anyone that's listening, watching, or will watch this at a later time, again, you hear it, it's happening, it's real. You got to pre-plan. You got to have, you got to see this ahead of time. Again, I guess nobody is losing anything by reaching out and getting more
Exactly.
a consultation, at least
Mhm.
knowing what they stand. Um,
Yes,
time is really of the essence. You're talking about we're in April.
absolutely.
There's really 5 months, if any, before this whole thing becomes a very, very lengthy process, and we don't even know how the economy is going to do because the
No.
constantly in a week, if not, they can change again. So
Yes.
um, please do take care of yourselves. All our seniors, stay healthy, stay safe. Anyone there, caregivers, take care of those folks, take care of yourselves, stay safe. Thank you for watching the iHealth channel and also listening on iHealth Radio. Michele
Thank you.
Albohn, thank you for joining us. In good hands, Medicaid Consulting, Long Island, but they do serve the whole New York State.
Well,
And
New York State.
you might get. Would you actually be open to a case from a different state if that happened?
Yes. I would have
Just
to,
thought I asked
before I
that.
took a case, I would have to feel comfortable with that particular state because every state has their own regulations. We do get a lot of people coming to New York for Medicaid from other states. So it gets a little complicated if someone has Medicaid in another state and comes here. But maybe in the future, but right now it's just New York.
Yeah. Well, there you have it, Michele Albohn.
Thank you.
In good hands, Medicaid Consultant. Again, check out the video, watch it, replay it, share it. You know, people would need to hear this.
Get
Uh,
help.
get help. That's it.
Get help. Don't
Stay
wait.
safe, everyone.
Stay
Sorry,
safe.
Michelle. Good.
That's okay.
All right. Well, thank you very much. And thank you for watching again the iHealth channel and listening in. This is Hurricane Age, and we'll see you and talk to you at the next show. Bye now. All right.
Okay. That went long. That went an hour. I'm surprised.